Welcome back to the season finale of Open Globe Talk. Today, we are joined by the renowned glaucoma specialist, Dr. Ike Ahmed. Now, last year at the AO, I met Dr. Ahmed and I asked him for him to join our podcast, and he said, absolutely. And it was so kind of him to do that because he's an incredibly busy person. As you all know, he's the director of the newly inaugurated LNS Crandall Glaucoma Innovation Center. And he also serves as the chief information officer and was the former medical director of Prism Eye Institute. So as many people already know, Dr. Ahmed is a visionary who saw the future of glaucoma by developing tools and techniques such as micro-invasive glaucoma surgery. And today, the world of ophthalmology truly is thankful for innovators like him, for their grit and their tenacity to make this field what it is today. Without further ado, I just want to thank Dr. Ahmed for coming today, and let's get started.
Well, thanks so much, Rizul. It's a pleasure to be here. I've watched your podcast, and you're a very good host and questioner. So I'm looking forward to having a good conversation, and appreciate your breadth of interest and your knowledge. And I wish you all the best in your endeavors.
Absolutely. So, Dr. Ahmed, what made you interested in ophthalmology and specifically glaucoma?
You know, I grew up wanting to be a surgeon from day one, and I wanted to be a trauma surgeon working in a busy, crazy trauma unit with patients coming left and right, having to make split-second decisions to save lives. I live on adrenaline. So that was my, interest in my first couple of years. And, as I went through medical school, I realized as well that, the quality of what we do isn't necessarily based on how big we do things. And literally, I stumbled upon ophthalmology and did some of my first electives, and I just fell in love with the specialty. I fell in love with the surgical ability to work at the finest of levels, finest technical details at micron levels to save vision or replace or improve vision. And I just love that idea of doing things in that way. And of course, the impact of our patients with their improvement in their quality of life was very visible, literally. And it really struck me that way. So I kind of went into this very surgically strong-headed minded. And that's one reason why the way I practice this way and the way I look at things in many ways is kind of a surgical mentality. That's kind of how I just jumped into ophthalmology.
That's pretty interesting you say this because, a lot of times people have mentioned it's through serendipitous chances that they get in life that they end up in ophthalmology. When you first got started, what were some key aspects of the field that you could already identify as a trainee that you could innovate in the future?
I'm kind of a bit of a disruptor. I'm a troublemaker. Maybe you could call me a shit disturber. And that's kind of the way I've been for a long time since I was a kid. And so, I just kind of gravitate toward the alternative, toward looking at things in a non-traditional way. In ophthalmology, when I train even now, there was some very cool, innovative things happening in cataract surgery, IOL technology, refractive surgery. That was a sexy area to get into. Retinal surgery was very cool and surgically oriented, and corneal surgery was evolving with a lot of newer techniques. And, a lot of people are going into those fields, and I thought it was really interesting. It was pretty cool. But in glaucoma, there was just so little things happening there. And I was always puzzled. And my training, my residency is very traditional glaucoma training. And I actually wasn't interested in glaucoma. But after kind of opening my eyes up and kind of going to conferences and meetings and just kind of, investigating a bit more, I realized that I thought glaucoma is an area that, wow, this could really be something to kind of change the way we think. And I was lucky enough really to just find the right mentor. And for me, my first and probably only mentor in my professional career was who I did my fellowship with. I was lucky enough to do it with Alan Crandall, and the rest for me kind of just opened up after that opportunity.
You mentioned Dr. Crandall's influence on you, and I'm kind of curious. How did he inspire you towards glaucoma? I'm sure that you must have applied and then you were hoping to find that mentor, or you weren't even expecting it. And somehow he ended up making, a career out of it for you.
Yeah, I mean, for many reasons, Alan, was an unbelievable coach, mentor, teacher, leader, and part of it is just, his surgical skills, of course, were renowned. And I saw him how he worked through difficult, complex cases. But more importantly is his mindset. Alan was a very humble man in our field. There are a lot of egos and people trying to reach up to, credentials and to awards and to, titles. And Alan was never interested in that. He truly wanted to do things for the sake of doing it for the right reason, to find a better way for our patients, to help people who are less privileged. He traveled around the world to do that. And so, those things were inspiring to me. And most of all, as a teacher, he allowed his residents and students and fellows to really, spread their wings under a very safe environment and come from it that wasn't judgmental. And that allowed you to kind of pursue your path. He was already doing things differently in cataract surgery than many people were doing early on in phaco. And he was already doing novel glaucoma surgery, like non-penetrating surgery at the time. People were not doing that, and he stuck with it, despite the fact that majority of people were not interested, or they condemned it, or they gave up on things. So, his tenacity, his willingness to be selfless in his pursuit of innovation in a very simple, humble way. Just very unique guy to be able to do that. That gave me a lot of inspiration to sort of, propel me to do more.
Mm-hmm. That's absolutely true. And would you say that positive feedback really helped when, you were trying to become this aspiring surgeon?
It's interesting. Positive feedback is very important. I think more importantly, negative feedback is the problem, right? I mean, people criticize, or, when it's particularly if it's in a personal way, or if it's in a not well-intentioned way, it can be discouraging, or in a way perhaps it's indifferent. Alan was a soft-spoken guy, actually, so he wouldn't necessarily actually give you like positive feedback on the spot. But I'd leave the OR, I'd go into the break room, and everybody would be talking about, what Alan said about me. So he wouldn't even tell you to your face, but he would tell everybody around you how amazing he felt you were. And, it was that kind of really appreciation that I think gave me confidence to do things. And you could tell that he was trusting of you and appreciative of that. So that's kind of what the feedback I got from it. And yes, you need to have that. It's more the right environment. I mean, feedback is important, of course. You need to have critical feedback too, of course. But the right environment to not be judged, to allow you to kind of find your own path and to do it together, and not have the ego get in the way of that kind of development. It's very easy for teachers to not want to see their students do better than them, right? And you're a big person in your field, and you may be threatened by somebody coming up under you, or even from outside. And for Alan, he actually wanted to see that. He wanted to see his students do better than him. He wanted to see residents and fellows do better than him, and to lead in different paths. And I think that was very refreshing for me.
Yeah, very well said. Kind of taking a forward seat here, can you tell us about a time when you faced a significant challenge or setback while developing a new technology or product, and how did you overcome it?
Yeah, I mean, I'm a pretty positive person, and I look at things very optimistically. But early on in my career, as we were trying to look at things differently, working with new devices and technologies, a lot of people didn't want to see those things happen. Maybe they were skeptical. Maybe they were worried or concerned. Maybe, they had other reasons, power. I think people who, those of us, all of us kind of want to be in a position of control. And when there's new ideas that come in, we lose that control. We lose that narrative. We may be worried about our own practices or where we sit in the world order of glaucoma. It's natural. We all have that. And I think that's part of our ego. I think that was probably the most difficult and probably the most hurtful aspects of challenges I found in pushing our field forward. God's my witness. I don't know. I'm definitely made a lot of mistakes. My intention, I really believe, I hope, was pure. It was to find a better way, a new way to try to find solutions, continue to push forward. I've always believed, and Alan's always said, if you're status quo and you haven't changed, you're already behind. I think truly there's always a better way, and we want to push that, but the resistance was quite fierce to the point of even sabotage and purposefully trying to, be cast negative, opinions and personal attacks on folks that are trying to push the field. I think that was difficult at first, seeing that. And others would be indifferent. Others would try to ignore you and try to push you aside and not give you any time to speak in that capacity as well. And that's also difficult as well when people are indifferent. So there's active antagonism and there was indifference. This happens a lot. We saw this in the IOL field in IOL developments and phaco developments. And everyone can sort of sit here and preach that, of course, and say that. But that was probably the biggest challenge that I found in development is those aspects of it. And you felt alone a lot. You felt alone a lot in where you were. There was a few people that really were supportive, even people who weren't doing new technologies, but who were in positions of power, said, you know what? I want to open up an ear to this and give a platform to discuss these things. And that was really helpful at the beginning. There wasn't a lot, but that helped. I found the right people that kind of had the same mindset to help me move forward. But those are challenging times, man. I'll tell you, I remember coming home from conferences and feeling pretty down because of the negativity and the real antagonism. I was a nobody, but people really found ways to try to attack personally and also behind the scenes. I'm not complaining. I wear my wounds with pride, and it makes you who you are. But yeah, I forget those times. But when you ask those questions, I do remember those times.
Yeah. And, Dr. Ahmed, I think people who go through that level of hardship and overcome it and are always very positive, those are one of the best mentors to have, because they know how it is to start from zero and going up. And I think that we have tremendous respect for people like that who make it that way, where we know that there are people without that backing and are still able to thrive in the field. And I know it must be continuously hard because every part of our profession has its own uphill battle. So you're recognized as a pioneer in MIGS and have developed many of the glaucoma devices that are available today. Can you speak on how these technologies have impacted global ophthalmology efforts, and particularly in regions where there are limited resources?
Yeah, I mean, it's a great question. And for me, everything that I've tried to do, it's always had a lens that this should be a way to democratize treatment for glaucoma, whether it's locally or internationally. Certainly, of course, we're blessed to be in a place that we have finances and we have resources to develop these technologies. They are quite expensive to do. I mean, to do a clinical trial and to run a business, I know it's, tens of millions of dollars. I see that firsthand. So that's where they often start, But we truly, as physicians, I mean, our oath is to help all of humankind, and it goes beyond the place where we live and the people that we have access to. It really means we need to kind of spread this around the world, and it's through that lens that I think we have to continue to try to develop that area. At the Moran Eye Center, as you mentioned earlier, with the Crandall Center of Innovation, one of our big pillars of the center is global outreach and global healthcare. I mean, to develop innovation in that space. And our goal is really to develop ways to, provide solutions for, all people around the world. We know the challenges globally with access, with resources and training. Obviously, a lot of devices and things have a certain cost to it. I believe these costs continue to come down, like we see, for example, with IOLs and cataract surgery. 30, 40 years ago, it was quite expensive to have these platforms. Now, we can do, cataract surgery, with just a few dollars with pretty reasonable IOLs that were very expensive before. So I see this continue to happen, but we have to find better ways to do things again in a lower cost fashion for today. And fortunately, for example, with MIGS, it's kind of brought back the, trabecular meshwork into light in terms of surgically augmenting outflow. And I think because we're doing this in an earlier stage of glaucoma patients and we're seeing better success, rather than the old days of doing it as a last case resort where it wasn't so successful, it's being used now around the world. And we don't have to have necessarily expensive devices for that. We have 25 gauge bent needles we can use to remove trabecular meshwork. We can use, a 5-0 Prolene suture, which is easily accessible in the world with GAT, So MIGS procedures, which is where a lot of work has been done, can be universally applied, with fortunately low cost. What I think is the other piece, however, of global international work is training. I think that is probably even more important. And I think probably one of the biggest barriers is training. I mean, trabeculectomy is still an important procedure. It's, again, a low cost, budget item. And between that and some of the low cost MIGs, we can do a kind of spectrum of patients, with those options. So, I think right now innovation, yes, is primarily occurring in the developed countries, and we'll see some continual work, moving it into the less developed world. But we still have a long way to go to just train our surgeons and our colleagues in the developing world to do, basic surgery and with basic supplies, which I think is a good opportunity to do that.
Yeah, and I think you answered my next question where, you mentioned some of the big obstacles facing glaucoma care today in the global arena. And you also mentioned, where that improvement needs to be from the teaching end, and as well as affordability end. Which countries would you say, you've traveled to quite a lot of these countries, where you think the biggest potential is currently, from a low middle income country perspective?
I think that you look anywhere around the world, I think there's opportunities. I think Africa particularly has a significant need and has, quite frankly, not had the appropriate attention where it needs to be, But even in areas in Latin America, South America, and Southeast Asia, we see vast underserviced areas. Glaucoma is something, even as far as a screening, approach is important. Most people with glaucoma in around the world, even in the developed world, are not diagnosed and they often present late. So even having, eye care practitioners or even technicians to be able to screen for glaucoma is an important step. It truly is the leading or second leading cause of blindness around the world, irreversible blindness around the world. There's a reason for that, and a lot of it is because of lack of identification, lack of diagnosis. So even that awareness amongst physicians, amongst, eye care providers would be an important aspect to do that. I mean, I think campaigns in Africa have shown that, that can make a difference. My area is primarily more on the therapeutic side, on the surgical and interventional side. And I think we're seeing some, really good examples, in Africa, in Latin America, where we've been able to make some inroads, both in training, but also in bringing new surgical approaches and also bolstering traditional approaches like trabeculectomy in terms of the, safe, controlled technique that needs to be done. There still are barriers. Follow-up is a big challenge for our patients that come into the care into the developing world. That's been a big challenge, So I think we still have a long way to go. I think that cycloablation procedures may have an increased role. SLT laser, these are procedures that are truly non-invasive. Mm-hmm. And I know there's a camp out there that feels that's probably the way that we need to go to glaucoma today, because it's truly a procedure that, doesn't have some of the potential real serious surgical outcomes that can happen when the patients are not followed up, although they can happen, of course, as well. So I think the introduction of laser trabeculoplasty, more so around the world, again, there are cost issues, and cyclotherapy and cycloablation, in the right way, I think have an increasing role in those places around the world.
Yeah. It's interesting you bring the SLT aspect into it, where, like it being non-invasive, it's a perfect modality to incorporate. But then we talk about, the population where screening is an issue. So most of these people are probably coming in with kind of like possibly moderate level of glaucoma or even severe, who knows, that I've noticed where, the prevalence studies are still lacking, in certain areas of the world where, I guess the attention isn't there. The next question I wanted to ask is, how do we work to ensure that the care we provide in underserved areas is culturally appropriate and sensitive to local beliefs and practices? I'm sure, glaucoma surgeries are, at least some of the surgeries, and all surgeries are invasive, but some of them are a little bit more invasive than others. How do you kind of tell these patients that, hey, this is what I'm going to do, and this is what it's going to do for you?
Yeah, I mean, I think the general approach, of course, I mean, is a colonial, non-paternalistic approach, and a collaborative approach. I think the best approaches are to work within existing healthcare systems and providers. I mean, each place has their own sensitivities. I mean, in some areas, there's a lot of distrust, for example, for physicians. Other areas where, the understanding of follow-up and the informed consent process is very different than it would be here, for example. So I think understanding the system where we're working is absolutely important, and working within that system. At the same time, I think there's learning that goes both ways. I think we can teach and improve some of those systems, and we can take back some of the learnings from those systems as well. And I think so that I think that learning and that open mindedness between those that are going into that environment and those that are currently in the environment are very important. Education is such an important piece for development, right? If there's one word to say to help the developing world and help folks that maybe have less access, education is empowers people. And I think it applies to anything, and it applies to your own healthcare and your own self-care. And I think that education piece is such an important part of that process. Ideally, again, done through the local community to communicate that and to have the right approach in managing that. Often, for example, it's working with the local leaders within the community that are entrusted to take care of their community, of their families, of the folks in the region. So I think it's the knowledge of knowing where we're going and how the practices are, and not coming in assuming that the norms that we practice here are very important. And remembering that things they happen slow, right? We're not going to come in there and just do 100 cases in a day. In fact, surgery may not be the most important part about this right now. It's more about, learning and understanding the cultures and the practices where we're working, and trying to work within those paradigms. I think that's really important. So that knowledge going in is so critical. It's like acclimation, right? You're climbing a mountain, you got to acclimate to where you're going to. You can't just go in there and just act like you're at sea level. Well, it's like acclimating to, to where, wherever we're traveling to. And it means immersing yourself in the region, understanding the practices. I find that the social practices are really cool to learn. Eating together and breaking bread together is a way to kind of learn how people are, and doing activities and stuff outside of medicine. I mean, that's how you really learn how we all interact. And I think that can apply a lot to then how do we try to, bring whatever knowledge we can to improve, the places that we're working in.
Yeah. And, I read that your parents came to Canada as immigrants. And I kind of wondered, what are some things you see locally that maybe we could improve upon as physicians, as ophthalmologists, when we tend to people who are coming in from a different country and are trying to acclimate to the area and the health resources available?
Yeah, I mean, I'm very blessed to be in Canada. We have been a safe haven for many refugees around the world in these difficult times. I think we have a very supportive environment for that, a very open environment. And I'm proud of seeing my fellow Canadian citizens open their arms and open their doors, seeing temples and churches and mosques and synagogues open their doors, to people in need. I think it's an incredible part of humanity, and it's truly what we as physician leaders should be leading that way, because that's truly what, again, it means to be taking care of people. That's why we're physicians, And so I think that's the most that is such an important part about what we do, is beyond just our own offices. So I think that, again, similar principles apply here. I mean, it's really understanding the experience of the people have come from. People have come from very difficult environments, being non-judgmental, learning about things in that capacity, and ideally liaising with folks that are from similar backgrounds are important. When my parents came, I mean, there was little support system for immigrants. We were fortunate enough to have really nice support from folks that were local, many generations in the past here in Canada, and that helped us a lot. So I think we've come a long way. I'm not someone to really overdo that, though, as well. I think it's just basic common human traits about taking care of each other. We don't have to get too crazy about, structuring too much. I think sometimes we go too far on that capacity. Just be a good neighbor, be a good person, do it with the right intentions, be open-minded, listen, and most importantly, listen to who we're dealing with. And I think that we were involved in a number of eye care screening. Sure, we picked up some disease, we picked up some difficult, patients who came in with serious eye problems. But most of all, I think connecting with people, was probably the most valuable experience for those that came and experienced the process, working together, and being provided for.
Yeah, and I agree with you. And a lot of times, as you mentioned, we might overdo trying to compensate for the things we don't know. But in essence, we realize that all of us are very much alike, and we just need to find that commonality between us. Um, can you share us about a particularly memorable experience you had while, providing ophthalmic care in a global health setting?
I mean, there are so many memorable experiences from, removing dense cataracts from people and changing their lives in a split second, taking off their patch and seeing their eyes glow and getting those tears running down their cheek and our cheeks and getting those hugs. But I know there's one particular patient that really stands out to me, which was on a trip to Ghana with Alan, on a young gentleman who developed cataracts at a very young age, and basically couldn't work, couldn't go to school. And I was fortunate to take care of him. I did his first eye. And he was from a village far away from where we were working, and he somehow found a way to continue to write to me. He wrote like 50, 60 letters to me. He somehow got them to me through different channels. And they were, every day how his life had changed. I returned back a few years later, and I wasn't expecting to see him, but he somehow knew I was coming. He basically searched me out to the housing where I was staying, camped out there looking for me, and found me. And I was just incredibly amazed to see how dedicated he was just to find me, to thank me. He could have gone his way and continue to do all his work and take care of what he had to do, but he found every opportunity to try to thank me, whether it's writing letters somehow or whether it was finding me. And the impact on an individual life, I think, really stood to me, and still does. I think that's probably one experience. And of course, training my colleagues from different countries and seeing them improve and get better, and using virtual means and physical means, and then seeing their satisfaction of helping people, I would add to that as well. I mean, seeing our colleagues improve their skills and their abilities, and hopefully at a small part of that amplifies what we can do. That's very satisfying as well. So those are some of the things that I take back from our global work.
Yeah, and it's really special to have patients like that, for them to take that time to, follow up with you. It's almost kind of like eventually, as the patient heals, they become somewhat of a personal friend of yours, trying to also encourage you in your path and reassure that what you're doing as a surgeon is incredibly meaningful for each one of them.
Yeah, and I mean, and there's a lot of learning from our patients. I mean, I think
Yeah.
that's something I've learned, and maybe I didn't quite appreciate that early in my career, because you kind of come out thinking that you're here to save the world, save people, right? But listening to our patients and learning from them is such an invaluable part of our development. And I think that's something that I learned, particularly going abroad, but also here locally as well, taking care of patients.
Mm-hmm. How many patients do you serve, like, every single day? How busy is your OR?
It's pretty busy. I mean, in the OR, of course, we're doing a lot of complex cases, glaucoma cases. So, I'm basically, and working with fellows in training. So our list can vary anywhere from, some days we do 8 patients and they're all very complicated, difficult patients, to doing, 20, 25 cataracts in a day. So it does vary day to day. In
Mm-hmm.
clinic, we see a lot of complex cases. My practice here is complicated. So people come in with a lot of different issues. So sort of high volume practice, and it's more of a very specific, specialized practice. We take a lot of time with our patients. We got to hear them out, understand their history, examine patients, do our diagnostics. So it's very interesting, because what I practice here is very different than when I go abroad. Here it's very complex, and patients with multiple surgeries, and we do all these diagnostic equipment, fairly expensive, I guess you could call it, in terms of surgeries that we do to reconstruct eyes. Going abroad, it's just some of the very basic stuff, just trying to stunt glaucoma by doing a fairly straightforward single procedure on a patient, for example,
Mm-hmm.
technically speaking, I should say, or cataract surgery. So, it's a different kind of experience. I often think that my life here is so different than my life when I go abroad and do other things. But I learn from both sides to take things I've learned, in the developing world, and bring them to the developed world, and vice versa as well.
Yeah. And actually, that's surprising for me that the surgeries you do abroad are a bit less complicated. But that just goes to show the need the fact that they are lacking that basic resource. So when you go abroad, do you kind of like teach these individuals like you're mentioning for like a sustainable solution, or are you just going there mostly kind of doing these procedures for the patients?
Because I think it's a combination of many different things. I like to combine, providing expertise that's not available. So I do some complex cases, of course, that they usually save them up for me to do, and they're really difficult cases to do with limited resources. But the bulk of my time is really to try to train existing surgeons. I would rather take 3 hours and do one surgery with a surgeon doing it than me do like 20 surgeries. I think that's much more rewarding, and it's really about teaching those to continue the work when you leave after a few days. That's kind of what I typically do. I've also found ways to do research as well. I think doing research and learning and developing more evidence-based data to support what we do, I think is very important. So that's been an important part of what we do. And innovation as well. I mean, in many ways, we've been able to bring innovation to clinical trials with the proper consent, the proper ethics, to different countries to provide care. I don't think it's a bad thing. It's able to actually provide care where otherwise the patients wouldn't get it, by bringing industry down, in those situations, bringing surgeons in those areas, training local surgeons, providing local population with access to care they wouldn't normally have. So that's kind of the mix of ways that I've been able to kind of try to bring all the parties together, to try to help in those areas.
Yeah, you mentioned industry, and it's so hard for industry to come to a low resourced area because for a lot of times they're thinking economically. What are some ways that you kind of convince them, hey, this is, a great place to do research, also help the patients, and this would actually be pretty economical for you as well?
I mean, it's got to be a win-win. I mean, some companies do have an altruistic part of what they do, and they want to provide some services beyond what they do for a business side of it. But it does have to be a win-win. And so some of it is, as you said, it is basically, conducting clinical trials and doing research. Now that may be looked upon as saying, oh, you're going to another part of the world and doing experimental surgery in that sense. And that can be a negative aspect to doing it. You have to do it very carefully, the proper process, the proper consent, the proper, approach to doing that. But for the most part, I think there is a win for industry to provide more understanding about these procedures and doing them abroad and doing them in other countries and seeing how results are. Just put together more data. A lot more, for example, a lot more patients need these procedures than they do even locally. So having a larger volume of patients provides a good data set to learn from. So I think that's where the win can happen. Algorithms can be developed from that, tweaking of procedures, understanding postoperative management, surgical technique, all those things can be improved upon, but not thinking of it in a way and not doing it in a way that is unethical. And that's what's really the important balancing act. I think that's where I found industry can work well together, can accomplish all those areas. We've seen good examples in parts of the world that's worked out really well.
Yeah, and I agree, and I'm really excited to see how those innovations take place. How do you see the field of glaucoma evolving in the coming years? You've been, a producer of really incredible tools that are currently being used, and I feel you're the best person to ask that.
I'm not sure I'm the best person to ask. I mean, I'm very much a person, my philosophy is, the ground floor of innovation. I like to work close to the ground. I don't have a huge visionary path. I never did in terms of I want to be doing this thing in 10 years or 20 years. So I'm not the visionary person. I'm the person who just puts myself to work, get down and do the work on the ground, work hard, bring energy, bring, positive energy, bring passion to this, bring people together, support people, give them a good environment, and just push forward, just push, because something good comes out of that, that synergy. I've been working hard in this area of interventional glaucoma. I do think that's where glaucoma is going now and should continue to go. But we're more active than passive. We're looking at dynamic looking at dynamic diagnostics to help inform us to when we intervening early in the course of disease. We're realizing the interventions work best not when the patient's at the end stage of their disease. Doing things when the tissues that we're working with, trabecular meshwork, distal outflow systems are still relatively intact and have not gone through secondary chronic irreversible changes that make it difficult for surgery to be successful. and really addressing adherence and the quality of life that our patients need to address. So that's kind of interventional glaucoma in a nutshell, which is where we are going. The future, well, right now, of course, this is very surgically, laser and drug delivery based, but the future is very much, I think, non-surgical, gene therapy and neuroprotection, I think, are exciting areas that I think in the next decade continue to develop, and what we're working on, for example, at the Moran. So that's, I think, where the next phase will be. But I'm excited because glaucoma has become one of the most excited areas of seeing development. We've had a lot of investment. We need industry in this area. We need money in this area to help grow the space. And we're seeing that happening here because people now are seeing the momentum. I think that's what's exciting. And I think there are many more people who are coming to our field and continue to grow well beyond me, to unlock some of the important barriers that we need to kind of overcome to finally treat this very debilitating and blinding disease.
I am actually pretty excited you mentioned interventional glaucoma, because when I was reading your description, I was thinking back to the difference between medical retina, and I wondered, is this going to be how glaucoma will be treated in a way in the future, where there's two different fellowships, eventually kind of encompassing different fields?
Well, we'll see. It might be that way. My goal, however, has always been that glaucoma should be treated at the comprehensive general ophthalmology level. Again, democratizing treatment to all practitioners and all patients. And that's why, for example, with MIG surgeries, I'm very happy to see it moving into that area. Doesn't necessarily require a whole fellowship to do it. You can do eye surgery, but you have to be trained. It's important to be trained. It's important to understand how to take care of glaucoma and follow patients before and after surgery. And I think that's something that can be trained, to comprehensive surgeons and general ophthalmologists, which I think is great. And yes, as a field of glaucoma, we're probably gonna continue to see that. We're seeing fellowships now moving more toward, training in MIGS now in the U.S. Most fellowships now train in MIGS. That wasn't there 10 years ago. Yeah. And we're going to see maybe it moving more toward the medical side or non-invasive side as we have more of these options become available to us. So I think things are very exciting. They're going to be disruptive. They're going to be unsettling to many people. They're going to be, they're going to shake some of the traditional corridors of power. There are going to be a lot of people that are going to resist that for different reasons, some good reasons as well. We're not going to just be, aimlessly doing things for the sake of innovation, but it's going to create, it has already created a lot of, unsettling behavior. And I think that's expected to be with any field that's disruptive. And our goal is to try to make people feel comfortable with development together. And when there's resistance, we just push through it.
Dr. Ahmed, lasting words that I kind of want to get from you is, what is an advice you would give to somebody who's, doing their residency, thinking about glaucoma, and is wondering, would this be the right time to, jump into this field?
I mean, I would just say that I think, just think back about why you went to medical school. I think for most of you, it was an altruistic intention. And I'm not saying it isn't now, but, life gets in the way and, business gets in the way and all the other interests come in there. And sometimes we lose that purpose about why we do what we do, why we're here. We're in a special field. We sacrifice a lot to do what we do. We sacrifice our personal lives, our family lives to do this. And that's the sacrifice we made when we took the Hippocratic Oath. It is. And to try to, skirt around it. And ophthalmology is, of course, a field where we do have a fairly good lifestyle. It's unfortunate, I think, when we kind of have different, that we lose that. I don't think people do it intentionally. So, find that passion, that zeal to, unlock some of the challenges we have that our patients in need, and continue to push forward and think of things differently. Challenge the norm. It's easy to be comfortable in a lifestyle and comfortable in your approach to just do that thing and be comfortable day in, day out. People do that well. I think eventually it does catch up to you, but put yourself out there and put yourself in uncomfortable situations to improve what you do. Glaucoma is one of those areas that is still evolving. We still have a big need to have more people, better trained in this, improve our abilities to, innovate and to improve our current approaches. So we need bright minds in this field. I mean, I see a lot of people interested in retina, for example, right? Which is great. I think there's, very, very, interventional in that approach, injections and surgery. I think glaucoma is an impressive of really, expanding into those areas as well. And I think there's a need for that. So, don't follow the crowd. I never followed the crowd, did things differently. It was hard for sure. It was alone. It was lonely. It was challenging. You fell down many times, But being different for me is I wear that with a badge of honor. I didn't like it before, but now I wear it with a badge of honor. I don't care if I'm different. I'm happy. I'm happy. I'm actually feel grateful I'm different and look different and act different, have a different path than others around me. It gives me an edge. So if you have that kind of feeling that you are different and think of things differently, then maybe this field is for you.
Awesome. Dr. Ahmed, I would have loved to, ask you if you come across roadblocks and let's say you're all alone and you're like trying to figure your next path forward. What do you usually do in those moments? Like, who do you reach out to people, or do you work in a closed space and think of something more innovative that could overcome those obstacles?
It's like anything else in life. I mean, for me, when there's an obstacle in front of you, you got to decide: are you going to go through it? Are you going to go over it? Or are you going to go around it? And there's always a way to get around things. There's always a way to do it. It may be longer, may require, different type of resources, a different place to be, different people to work with, but there's a way around it. And I think it's knowing when you got to make that pivot. I think it's very important to do that. Obviously, having good people around you is ideal. It's great to find that person. Sometimes you don't have that, though. I don't always have that, honestly. And I very much did things on my own. I sat down and looked at things in many different ways. I would read a paper. I would think about a particular problem, and I would bang my head on it. And then one day I see it differently. I'm like, why didn't I see this differently than I did for the last 20 times I looked at it? So often the answer is sitting right in front of you, but because you're looking at it through a certain lens, because of the way you've been taught, the way you've been told, the way to do things, you're not going to find that answer. But looking at it from a different perspective and finding out things critically, rather than, just linear thinking, I think can help you to kind of find those solutions and try to find that way to get around things or over things. And sometimes you do have to barrel through things, of course, as well. But I think that's what you have to do. There are roadblocks all the time. And it can be quite frustrating. To this day, I still find those roadblocks. And the last thing I'll say is this: I take things pretty personally. They say business is business. I take things very personally. That's good and bad, though. So when I find a roadblock or I find a problem or someone is in my way, for me, it's personal. And when things are personal, you really reach out and get every part of your emotion and part of your intellect and your cognitive abilities to get through it. If someone, think about that. Business, you can say, okay, it's just business, you just whatever, next day. When you take things personally, you put all your effort to get over things and to kind of get past it. So for me, I think I do that. And maybe it's not always good because it kind of can be all encompassing. There are nights, for example, where I'm only focused on a particular issue because it become personal for me. I don't mean to be vindictive in anything. No, I mean that it just propels me and gives me the fuel to say, you know what? I'm going to put every single ounce of my effort to solve this problem and get past this roadblock because I need to do it because it's personal. So that's it doesn't make any sense. This is the way I think of things.
Yeah, that personal confidence and belief is really important. And I certainly think that a lot of us in our journey in medicine need to have that, because that understanding that we will persevere and find the right path for ourselves is really important. Ultimately, we became doctors for a reason, and it is to hopefully help people and help them through really difficult times. Dr. Ahmed, thank you so much for coming on tonight. I think this was a really nice ending to our season 2 finale. And for all the people watching, season 3 is going to come out with some incredible medical students and trainees who are going to make Open Globe Talk an even bigger platform. So thank you, Dr. Ahmed. You have put the cherry on the icing here, and I hope you have a wonderful day.
Well, thanks so much, Rizzo. Thanks for having me here, and I wish you all the best. I mean, you definitely, I can see, look at things in a bit of a different way. So I identify with that, and keep the pursuit going, right? I mean, if there's going to be the answer to our problems that are unsolved, it's not going to be the folks that just go the routine path, because they're going to get the routine results and they're going to get the routine answers that we already know. It's those that have a different view of things, a different path, a different approach, a challenging way to get things. They're the ones that are going to find the answers, because that's how we uncover things that we don't know. So good luck with everything you're doing.
Thank you.